my dear friends, and specifically my dear physiotherapy friends, I have come up with a new important but not implemented area of our physiotherapy practice. Friends, in the past, doctors were considered as God. No, not nowadays. Many patients sue the doctors with huge amount, and all the doctors almost in India are covering their practice. So will be for physiotherapy in future. A webinar was organized by Amit, Alexa Cover You Insurance, and Dr. Dhara Sharma, who worked with me at AIBS Physiotherapy College, Ahmedabad. Friends, with this insurance, with a nominal payment subscription, you will get a big amount of coverage. Since this program was awareness program, and so is my YouTube video. For detailed details, you must contact Amit, Alexa Cover You Insurance. A family friend for your family and friends. Jaga ત્યારથી સવાર. Awake, arise and go. It is free. Friends, please see below my video and press subscribe and bell button. It is free. You will get my videos automatically. Thank you.
A wonderful opportunity to also have his views on whatever we are going to talk and discuss today.
Absolutely. It's a great honor, Dr. Dilip, that you are with us here today evening from America live. So that's a great honor.
Only unique insurance broker who is providing you this particular professional indemnity insurance with the maximum features. For example, all sources of medical negligence notices are covered in Cover You's professional indemnity. So earlier what was happening is that notices were coming only through district, state or national levels. But now what is happening is that because of technology, notices are coming through WhatsApp also, through SMS also, and of course there are threatening calls also that are coming to doctors. So all sources of medical negligence notices are covered. Now we have 500 plus medical legal lawyers on our panel. So that means that the moment you receive a notice as a doctor and you share that notice with Cover You, within 2 hours we have the power to allocate the lawyer Cover You and exactly what we will be doing for all of you. So I hope Dr. Dhara that my screen is visible.
Yes, sir, it's visible, sir.
Yes.
Right. Thank you so much. Thank you. Yes. So, Cover You is our trade name. Our company name is Alexa Insurance Broker Private Limited. We are India's largest insurance broker for healthcare professionals. And I think you heard that right. We are only uniquely taking care of the medical fraternity of our country. So what I mean to say by that is that there are more than 300 plus insurance brokers in our country. Two-wheeler policy ported to us. And of course, if you want to buy a fresh one, we are always there. So we are giving you a 25% discounted better deal than the standard market, number one. Number two, there are many features like zero depreciation, consumable cover, engine protection, key protection. These features are available only up to 5 years in the market. But Cover You is giving you all these features up to 10 years. And lastly, there are many features which were absolutely not there in the industry, like tire protection, loss of personal belongings. This happens a lot. Of course, dedicated claims team. All these things are also available if you take
Insurance.
So this is not also a term policy that in case, a physiotherapist dies, then also professional indemnity will help. I'll be very clear. Professional indemnity is only for medical negligence lawsuit notices and cases. So basically, you have taken this policy. Now you're taking care of patients daily. Like doctors have actually given video testimonials for us. So I believe I have a 20 years experience in the industry. I have seen that the most demanding profession is a medical profession. And doctors are always tight as far
People
as...
planning to come to America, I'm not just carrying them, but whatever you are doing right now in India as an awareness, in America it is an act and already in action. So they have to think about it right from there. Number two, all the therapists practicing should do evidence-based practice and continue reading the research articles. Number three, in America, all the therapists has to have insurance coverage for their mistake or negligence. Even if there is a mild mistake, people just to get money, they sue therapist. So covering up is very important. Number four, now about, this is not just insurance, now I am talking about the clinical practice. Many of our patients are old persons and they have many other problems. So we have to be very careful. Their skin is fragile. Even if you just do some forceful movement, it will break. They take blood thinner. So with some minor force, there will be bleeding. They have sensory deficit. All sensory organs sensitivity is reduced. Their eyes, ears, proprioception. Then I am also talking about one technique here they practice. Break the fall, ease on floor. That is the sentence. Break the fall, ease on floor. So suppose you are treating a patient and you feel that the patient is likely to fall. It is not under your control. So what you have to do is this: break the fall and ease on floor. If you are near the bed or chair, gently put the patient on the bed. Number two, if you are not near the bed or you are in between, in the middle of the room, then first make a shout, help, help, and then break a fall and ease the on floor is the technique. Means you allow patient to go gradually down. So you force, you are not able to hold, but do not just let go and fall him. Take your muscle eccentrically work and let the patient go down gradually. So minimal injury. Number three, when the patient is going down, try to put him on his butt rather than head. And number four, almost all they know that when we are treating hemiplegic patient, we have to be on the affected side. While
Thing is, if there is a physiotherapy setup which is based in a institute, a physiotherapy college, and there is a physiotherapy OPD which most of the academic institutions have it here in Gujarat, and Gujarat is full of physiotherapy colleges. There are a lot of physiotherapy colleges in here. So is there a provision where a college OPD can be covered under this insurance?
Right. So I think your question is linked to one clear answer I'll give you. So let's say you've taken a professional indemnity for yourself. Okay. Mm-hmm. Now, whether it is a college where you have operated a patient, whether it is an institute or a hospital or a government situation or a setup, 100% you are covered everywhere.